Hello, friends. In this episode, I'd like to share a little bit about me personally and my testimony of why I became a patient advocate. So, I'll start with telling you a little bit about myself. I went to both Auburn and Alabama. Roll Tide. I graduated college to be a speech language pathologist, but I always wanted to work in the operating room. So I switched careers and became a medical device rep where I got to work in the OR. I worked for several medical device companies representing multiple specialties. And my last job focused on kidney stones. Ironically, my dad has kidney stone disease. At the time, before I became a patient advocate, my dad had a kidney stone and was treated at a facility. He was scheduled to go on one of his bucket list trips to Montana when this medical event occurred. And he was told by his healthcare team to go on your trip, gave him 90 Oxycontin, and told him, just go have fun. Well, my parents live out of town and were flying out of Birmingham, which is where I live. And they would be spending the night with me, flying out the next morning. When they got to my house, my dad was gray in color, lethargic, and in severe pain. When I learned all that had transpired with my dad, I immediately contacted a urologist that I worked with, just trying to get some advice and help. And he told me to bring my dad in early the next morning and he would see him before his clinic started. So, of course, I canceled his trip to Montana and instead we went to the doctor. It was then that we discovered that now my dad was in AFib due to the severe pain he was in and the amount of Oxycontin that he had taken. Now, I'm going to preface, my dad has never had a heart problem. He was immediately admitted into the hospital so that they could get his heart back into rhythm so that he could have the kidney stone removed. It took 3 days before they got his heart corrected so that he could have this procedure. Once the stone was removed, the urologist told me that the kidney stone was about the size of a golf ball and that if he had gone on his trip, he would have probably gone septic or died. So that is when I immediately left corporate America and started my company, Hughes Advocacy. I've been a patient advocate for over 8 years and I'm board certified. I advocate for better health care for my clients in Alabama and elsewhere. I have over 25 years experience working in the medical industry, and I equip, empower, educate, and teach patients how to get the best medical care that they need and deserve. I've emerged as a national advocate for patients. I was appointed by U.S. Secretary of Health and Human Services, Xavier Becerra, to serve a 3-year term on the National Advisory Council for the Agency of Healthcare Research and Quality. As a resident of Birmingham, I'm the first Alabamian known to ever have served on this prestigious council. And what we do is we address the quality of care in the United States. Also, on behalf of the White House of American Innovation, I was invited to attend the Blue Button 2.0 Developers Conference at the White House to discuss improving patient care. In addition, I'm a Patients for Patient Safety U.S. champion, a member of the National Patient Safety Board, and an active member of the Greater National Advocates Organization and Solace Health. I'm also an APHA Emeritus member of the Alliance of Professional Health Advocates. Thank you for allowing me to share my personal journey with you. My hopes and goals of this entire podcast is to assist you and your loved ones from having a preventable medical error occur to you. I truly have a passion for patients, so let's be the change together.